Coming up on Body and Soul, waking up your brain.
At around 15, the sense of stillness started to just go away.
How chiropractic treatment bridged the way from extreme vertigo to a normal life. The benefits of keeping body and brain working together.
This last 10 years has been the decade of the brain. As a consequence, we've had an explosion in brain research.
And why Lucinda Harmon believes she's a very lucky woman.
I function extremely well for the health I'm in.
Over the course of researching and producing this series, we have found and told you about a number of remarkable healers. But the word remarkable doesn't seem quite enough to describe the doctor you're about to meet. Hi, I'm Gail Harris. Welcome to Body and Soul. The first time we heard Ted Carrick's name, we were told that he's a chiropractor who wakes up coma patients. And in fact, he has done that more than once, bringing them from a coma back to consciousness. That's just one of the ways this chiropractic neurologist helps people others had written off find their way to optimal health, even when that path is long, discouraging, and seemingly impossible.
I used to sort of do these bargains with God, and I would say, okay, let's say I get to 50, we haven't found a reason for this, and there's no cure, then here's the deal. How about if I die at 50? Then I will put in enough time that I'll get to go to sleep and be out of pain.
For more than 30 years, actress, teacher, and writer Mary Angela Pino lived with a feeling that she was constantly moving. Something as simple as walking across a bridge like this would terrify her.
I would put my back up against the side of the bridge, never looking down, trying to keep my eyes level.
Wide open spaces were even worse.
I couldn't live in a canyon because the roads are windy, and also because at any given time there could be a vista that had too many levels, too great an expanse, and I wouldn't be able to handle it. At around 15, I had my first sense of, first of all, my body not cooperating with what I wanted it to do, and the first feeling of instability, of, wait a second, something's moving. Is something moving in the house? Is something moving in the room? The sense of stillness started to just go away.
She developed other symptoms by her mid-20s.
Pressure in the head, headache, vomiting, nausea always. I was pretty much nauseous, I would say 5 days out of 7. It had gone into a spinning, which people call vertigo. I was embarrassed, really mortified, if I started to feel a spell coming on and I was in public. I would know that I had minutes before I would, I needed to be in the bathroom, and if I didn't make it to the bathroom, that I was going to lose control of my bowels, wherever I was.
Conventional doctors diagnosed her for years with everything from manic depression to diabetes to brain tumors.
I also had an incredible amount of shame. What was it that was wrong with me? Why couldn't anybody find it? I remember in my late 20s pulling the plug on traditional medicine because I'd exhausted everything. I'd been to every kind of specialist. I'd been to a neurologist. They ruled out a brain tumor. I'd been hospitalized. I'd had every conceivable test and dye shot in my body and, x-ray. Then I would hit pockets of time when I thought it would be better if I was dead, because at least I'd be still. I was never still, never, even in my sleep. I couldn't really lie down flat. I couldn't turn over. So it was a sense of being imprisoned. And how long was the sentence going to be?
2 years ago, as a last resort, Mary Angela decided to see a chiropractor.
I remember reading about it and thinking, I'm not letting anybody snap my neck. Because that's the way it's described. You know, somebody's going to put you on a table and they're going to go, and it was terrifying to think that because what if they did that and they made it worse?
I'm going to move it from his right to his left.
Her Los Angeles-based chiropractor, Dr. Kathy Power, wanted her teacher, Dr. Ted Carrick, to consult on this difficult case. Mary Angela at first refused. 30 years of misdiagnoses had left her with little hope.
I didn't want to talk to him, and I definitely didn't want to see him. But I said, you can email him. And that started the dialogue between myself and Dr. Carrick and Dr. Power. And I also asked Dr. Power to ask Dr. Carrick, even if he thought he couldn't help me, not to say it right away. So there was this feeling of, give me a chance. Almost like I'm a really good patient if you just give me a chance. And he wrote back that if it took a week, a month, or a year, 10 years, that they wouldn't quit on me. So I started to relax.
You need the whole brain to work well. But what we didn't realize until around the 90s was that when I take a hammer and I bang it with my right hand, that the information from my right hand is going to come back up to the left side of my brain. And if there wasn't...
Ted Carrick is one of only 570 chiropractic neurologists in the world. They specialize in diagnosing and treating neurological disorders without drugs or surgery.
My assessment was that Mary Angela suffered a non-ablative left cortical lesion, which simply means that there's something wrong with the functioning of the left side of her brain when we compare it to the right side. With Mary Angela, as with other patients that suffer from intractable vertigo, we have a loss of equilibrium, literally, between different areas of the brain. If one side becomes more dominant, it overshadows the effect of the other side. Or we would say it's simpler to suggest that the entire brain must work in harmony. It is an orchestra of humanism, and the concert that orchestra can play could be dominant woodwind, dominant brass, or it could be majestic and playing in something that produces a symphony.
To produce that symphony, Dr. Carrick prescribed neurological exercises to increase the functioning of the left side of her brain.
I do everything on the right side of the body. All of the exercises on the right side of the body. The right side of the body is connected to the left brain. And so what needs to get fired up because of the weak link is my left brain. I have socks and you can use pretty much anything, just something that has resistance. So when I'm squeezing, activates the left cortex. One set of exercises I can't really do to myself. It includes pulling my fingers, so taking each finger and pulling it like this. It's really a chiropractic adjustment, and it fires up the cerebellum. I'm keeping my eyes focused on my thumbs. So what's happening is that I can see that the room's going kind of in the opposite direction that my hands were going. And then back here. Now we can test and see how balanced I am.
After 2.5 months of treatment, Mary Angela's world finally stood still.
And they're even. I did not have an experience for 30 years of terra firma until about 2 years ago, of what it was like to be still or to put my feet on the ground and go, that's solid. Wow, I know solid. I have said to people who have asked, well, what was the treatment? What did you do? Well, that looks so simple. That's really, nobody had to cut you open, so it's this non-intrusive, non-invasive, right, approach that was very caring, and how could that be? The truth is my initial response was, it's a miracle.
Chiropractic treatments are like this every day. And when you hear them, it just makes you want to serve a little bit more. And it also is the reality to realize that the next patient you see you may not be successful with. It doesn't always work out that way.
Mary Angela now has the kind of life most of us take for granted.
I live in a canyon, and I love looking at it, and I love hiking it, and I can traverse, hills and stand on the edge and look over. There's a new man in my life that I met about 15 months ago, after the diagnosis and the cure and being given back my life. So he and his wonderful daughter only know about this in story form.
Excellent. Glad we're all here together.
And so it's kind of like
Thank God for all.
a new chapter.
A bridge that once would have been a barrier in her life is now a path to freedom.
I walk across a bridge to get to my house. I looked down, I watched myself walk across the bridge, in the middle of the bridge, this wonderful stream. I'm free and I'm home. Hey, you knucklehead. Hi, sweetheart. Hi, hey you.
Ted Carrick has been practicing as a doctor of chiropractic for the past 21 years. As a chiropractic neurologist, he describes his work as neurology that doesn't require drugs or surgery. For the benefit of people who may not know what chiropractic is, let's go through some of the basics. What is it? How does it work? Where did it come from?
100 years ago, a fellow saw a little lump in someone's back. The person happened to be a deaf person, and he pressed on it, heard a big crack, and the person's hearing came back. So it was a miraculous discovery or observation at that time. As we exist today, chiropractic physicians utilize spinal manipulation or adjustments as well as other non-invasive techniques without drugs or surgery to cause changes basically to the nervous system of humankind.
How is it that we get ourselves so twisted up to begin with?
Well, that's the great question. The fact that we walk up on two legs and we're subject to stresses from the Earth's gravitational field that can cause different misalignments.
So basically, it's what? It's how we sit, it's how we stand, it's how we walk?
I think it's a combination of everything. It's a combination of your own genetic makeup, your experiences that you've had, whether you've had an accident, a birth trauma of sorts.
How do you know when chiropractic treatment might be the best thing to do?
Well, I don't think you really ever will know whether it will be the best thing to do until you present yourself. Two different people with the same symptoms, one might be a candidate, one may not. We look at certain parameters, whether they be the strength of a muscle, whether it be the degree that your pupil will constrict, the way your face is when you smile. We want to see how they walk, how they talk, how they stand, how they sit, what their heart rate is, how their digestion is, what they eat, what their job is, what their societal position is, what their family relationship is. All aspects of their perceptual being as well as their physical being are important in our jobs.
How about the people you can't help?
Well, there's many people that we can't help. The wonderful thing about chiropractic is there's really very little downside. That is to say, it's going to work or it's not going to work, and the practitioner is going to know in short time, and you will as a patient know in short time, whether there's going to be a benefit. We're not going to cut out a piece of your body. We're not going to put something in your body that may have side effects that we don't even understand. But we're going to do something, and based upon our observations, we will be able to note if there's going to be a change.
So if someone's been having a problem that is not responding to conventional treatment, would it be reasonable for them to come to a chiropractor?
I think it's reasonable for them to see a chiropractor regardless if they've had any other treatment at all. Certainly any condition of the human form is amenable to chiropractic treatment.
I think when most people think about chiropractic treatment, they tend to think that that might be an appropriate place to go if, for example, you have a problem with your back, or you have a problem with your knee, or you have a problem with your shoulder. You wouldn't necessarily think of it for something like migraines or menstrual cramps. I mean, can it work for those kinds of things too?
Yes, absolutely. And I think what happens is the word of mouth type of advertisement that chiropractors have been enjoying throughout the history of the profession, where individuals will typically go to the chiropractor with the worst disorders because they've gone through traditional medical treatments first. Virtually, there's nothing that you can talk about that somebody hasn't seen a chiropractor and been cured about. And it's important to realize that chiropractic treatment is not a treatment that is specific for a shoulder or a knee or a gut, but is a global body treatment that, in fact, if you have back pain and you go to the chiropractor and the back pain goes away, it's easy to identify that as specific for the back, but it certainly isn't. The ramifications are greater. We're learning now to measure the other things associated with the back pain patient, and all of a sudden we're amazed. Someone may have a skin condition clear up, and you wouldn't think of going to a chiropractor for a skin condition, but if you talk to the person whose psoriasis went away after an adjustment, both he and the doctor are pretty well convinced, and when you see in a trial that more and more people, there's promise. What we're finding is that the applications of chiropractic are grossly underutilized by society, that people will come to the chiropractor as a last resort, and most of these people will walk away satisfied with their treatment or have a lifestyle change. And this, of course, has made the chiropractic profession, by numbers, one of the most popular healthcare modalities in the world.
Even if your back is feeling fine right now, there are ways to keep it working better, with or without a chiropractor. Your spinal column contains 24 little bones called vertebrae stacked on top of each other. And even normal daily activity can cause any one of these vertebrae to be wrenched out of place. When that happens, the bone can press on a nerve or blood vessel and irritate it, causing pain and interfering with the flow of life energy from the brain to the rest of the body. Doctors of chiropractic say that keeping your bones where they belong allows your body to work the way nature intended, and also increases its inherent ability to heal. When treating problems such as shoulder pain or a chronic headache, chiropractors use adjustments to put the spine back into proper alignment. What can you do to help keep your back healthy every day? Well, here are just a few pointers. You'll find more on our website. First, when you wake up every morning, start with a few stretches. Reach for the ceiling, touch your toes, and then give yourself a complete body hug. Wrap your arms around your body, then turn as far as you can to the left and then to the right. When brushing your teeth or washing the dishes, remember to stand up straight instead of bending over the sink. Hold the telephone with your hand or use a speakerphone instead of cradling the phone between your head and shoulder. At work or home, take frequent breaks, get up and move around, and stretch as much as possible. Finally, carry as little as you can in that bag or briefcase that you lug around every day. A heavy bag jammed with stuff, especially one that you toss over one shoulder, can throw your shoulders and back out of alignment. Bottom line, stand up straight. Take a deep breath. Actually, take lots of them. And remember, it's better to prevent a back problem than to fix one. We found another of Dr. Carrick's patients in the middle of the country, not far from Dallas, Texas, where, despite daunting physical problems, Lucinda Harmon manages to make her way through life with grace and courage and an absolute determination to help others do the same.
Hey, Murray.
Hey. How's the hike going?
What?
How's the hike going?
Oh, we're having a good time. You know, we always do.
What are you doing here?
I got to bring my art pad out here. When we get this all set up, I can come out with my art supplies and I can draw and I can do my watercolors. I love it out here.
Lucinda Harmon lives in the small central Texas town of Belton. A former professor of neuropsychology, one of Lucinda's first loves was the brain.
The neurochemical, the anatomical. I fell in love with it in my undergraduate work in a course called physiological psychology, and then mind and brain. Just fell in love with it and went ahead and got my master's and PhD in that field. You're in the group 4 study group, but what's your hemisphericity? Do you know what your hemisphericity is?
This is a wonderful woman who has a knowledge base second to very, very few people. She understands the brain and nervous system. It's her life, and yet she has one that wasn't working.
Lucinda's problems started with a disease called Ehlers-Danlos syndrome.
It's a connective tissue disorder. I have a rather severe case of it where all my joints dislocate. Between the time of diagnosis at 21 and the 40 years old, I was only in a wheelchair one time. I was very functional. I walked around in 3-inch spike heels. I looked great. I loved it.
7 years ago, that all changed.
When I was 40, I was bitten by an insect, a spider. And yes, I definitely have arachnophobia now. And I've never watched the movie. But the spider caused not only an allergic reaction, but it was also a neurotoxic spider. Its venom attacks the nervous system and causes all kinds of neurological problems. And indeed it did.
Those neurological problems triggered episodes like these.
That's a girl. Let's do it. Lift him up.
I would go into what would look like a seizure and was not. I was blocking on words. I could not speak well or fluently. I was having tremendous difficulties with remembering anything.
Her own chiropractors couldn't help her, but since the problem was neurological, they turned to Dr. Carrick.
That's it. You seen double at all?
Dr. Carrick realized that her brain wasn't getting enough blood.
So with Lucinda, these fine little fellows here would constrict and they would starve this area of the brain. Okie dokie, there you go.
It's the closing off of vessels to where that part of the brain is not getting any oxygen. And that is really, really close to stroke.
Open your eyes up for me. That's a girl.
His work with Lucinda reestablished blood flow to the affected part of her brain.
I'm just going to do something down into your shoulder. Okay. Now, what I'm going to do to you, we're going to get these hands working, right? So I want you just to sit this way here, and I'm just going to come over, it's like hug time, okay? Here. What I'm going to get you to do is I'm going to get you to push your head over this way here. Open your eyes for me. Open your eyes. That's a girl. Okay. Oh. Yeah, okay. Good.
Dr. Carrick helped restore her quality of life, but her disease remains incurable.
No, I'm not going to be healed. I have a disease that is genetic, that cannot be cured, that will be with me the rest of my life. But I function extremely well for the health I'm in.
Lucinda is no longer a college professor.
We're going to expand it beyond the medically fragile into also the emotionally and cognitively fragile.
She now spends her life working with everyone from the homeless to others like her who have special needs.
I got it arranged, got oxygen delivered. It's pretty hard to recognize what a person in a wheelchair needs until you've experienced being in a wheelchair. You don't think about things until you sit there and you've rolled a mile in those wheels. God presented all of the assets that I've got, and I was wonderfully and fearfully knit in my mother's womb, and there was purpose to it. There's purpose behind every single thing, and God has given me the great joy of recognizing that my purpose is more fulfilled from this wheelchair than it ever was before.
Lucinda has a disability, yet she escapes from it magically. Although she's in a wheelchair, she soars above most people that she comes into contact with.
I love to drive. I enjoy driving. I got my van after 5 years of not driving. A little 5-inch steering wheel, gas and brake that are in my right hand that are literally zero effort, and that's what it's called. It's a zero effort driving system. I've put 60,000 miles on that van in a little over 2 years and loved every minute of it. I drove 7,000 miles in the month of May after Ted treated me in March. What more can you say?
Her life now includes a live-in companion, Quint Essential.
My Quint boy. Without Quint, I could not live alone. He assists me to transfer from my wheelchair to my bed, to the toilet, to the shower, whatever.
Oh, that's right. That's the other one. Yay, Quint, come here, boy.
He retrieves anything I drop. He assists me in taking my clothes off. When my legs are spasming, he will get on them and lay on them and provide the extra weight that they need in order to stop spasming. He wakes me up if I'm not breathing properly. He can go for help.
That was so good.
He provides the most wonderful companionship and entertainment.
You're such a good boy. You do love your mama.
You may want to ask Grandma which is more appropriate.
5 years after the spider bite and just 2 years after Dr. Carrick's initial treatment, Lucinda is planning her daughter's wedding.
Upcoming wedding, yes. My wonderful daughter, who is 25 years old, is getting married. Some of my friends who have daughters who've gotten married say, well, have you all just pulled your hair out? Is it just... And I said, no, it's been wonderful. We are doing the wedding here at what's called Overlook Pavilion, looking out over Lake Belton. I've had a wonderfully rich life, and it gets richer every day. I'm the happiest person I know. Life was not good life was very, very, very painful, but I learned a tremendous amount through that pain. And in that, there's so much joy on the other side of the sun.
That's it for this edition of Body and Soul. I'm Gail Harris. Thanks for joining us. Until next time, be well. For more information on this program or others in the series, look for Body and Soul at pbs.org.
This is PBS.